Hello, and welcome back to my podcast on my euthanasia project. Today we're going to be talking about euthanasia law and policy in varying countries. In America, assisted suicide is only legal in Washington State, Oregon, California, Hawaii, Vermont, Maine, New Jersey, and Washington, D.C. Montana also allows assisted suicide, but they don't currently have a Death with Dignity Act. In these states, a second doctor must be consulted to determine eligibility. To qualify in these states, the patient must also be terminally ill and there is no requirement of suffering. In Washington State, Oregon, and Vermont, the patient must see a mental health professional to determine that they're not suffering from a psychological disorder that may be impairing their judgment in this decision. Now in Canada. Canada has euthanasia legal in its voluntary form, and it's referred to as medical assistance in dying. It was legalized in June of 2016 for terminally ill adults, and it can be performed by either a physician or a nurse practitioner. So what happens is either the nurse practitioner or the physician can administer a substance that causes death, which can also be a lethal injection of a drug. And for patients to qualify, they have to have a terminal illness that causes the endurance of intolerable suffering. Now on to Russia. There wasn't much that came up in my research of Russian euthanasia laws and policy, but what did surface is that assisted suicide is not legal in Russia, and they even have stricter narcotic regulations on narcotics such as morphine. In fact, those are more stricter than those imposed by the World Health Organization. And because of this, there have been cancer patients in Russia that aren't getting their appropriate dosage of painkillers and are actually killing themselves and committing their own suicides. They're going unassisted because of their suffering, that a lot of which could be managed with more painkillers. Now for Japan. So Japan has no official definition on euthanasia. That also means that there are no statutes, regulations, nor official guidelines on euthanasia. Japan, though, does have a Death with Dignity Act, and that allows natural death, but nothing on like assisted suicide or any sort of action around the realm of natural death. Now we'll look into Belgium. Belgium says that assisted suicide is legal for competent patients that are suffering constantly and unbearably from a serious and incurable disorder. While the disorder does not have to be terminal, additional checks are put into place for non-terminal disorders. Furthermore, patients under the age of 18 may request to be euthanized with parental consent. And additional scrutiny is put upon the child, and euthanasia is not performed on the basis of suffering due to psychiatric disorders. This is the only country, other than the Netherlands, that permits euthanasia to be used on minors. Candidates of all ages must be seen by 2 doctors to determine eligibility. Speaking of the Netherlands, assisted suicide is legal for competent patients so long as the suffering of the disease is unbearable and incurable. The illness does not have to be terminal, and there is no limit regarding painful suffering. In fact, they're actually quite loose on their suffering. Valid forms of suffering that can be considered for euthanasia are fear of suffocation, physical deterioration, and loss of personal dignity. Patients 16 to 18 may also request euthanasia or assisted suicide. The parents of these 16 to 18-year-olds cannot legally veto the decision, but they must be legally consulted. Competent patients of ages 12 to 15, on the other hand, may also request euthanasia or assisted suicide, but the decision does require parental consent. This is one of 2 countries that permit euthanasia, the other one being Belgium, to be performed on minors. Candidates of all ages, once again, must be seen by 2 doctors in order to determine eligibility for euthanasia, and a doctor must furthermore report the death to a coroner who passes the case to a regional committee to ensure legal requirements of euthanasia were followed appropriately and accurately and legally.